Assalamu alaikum wa rahmatullahi wa barakatuh to all of our viewers and our listeners and all of those who have been following our various videos and conversations. This is the next edition of the cases that we've been looking at that have had remarkable turnarounds. And I'd like to introduce a very dear friend, Mu'min Abu Eid, who is also known as Mu'min Khalil. And he recently went through a very dangerous and life-threatening and challenging case, which he's going to elaborate on further. Mu'min, who not only is a dear friend, but he's a vital member of our community. He works with various charitable organizations and has been doing so for decades, serving the community and helping the poor and needy here in Jordan. He is indispensable in this role. May Allah reward him immensely for the work he's been doing. On a professional level, he's a mechatronics engineer who's been working for more than 20 years in this field successfully. And we'll hand things over to Mu'min just to hear a little bit more about this case. Mu'min, welcome.
Yeah, hello, Salam. Thank you, Sidi Rami, for your this intro. I don't deserve, but thank you very much for that. Jazakumullah.
No, you deserve more. You deserve more.
Allah,
I read the article about your case on tib.com, and we wanted to interview you to ask you about this case face to face. And the first question I have for you, Mu'min, after welcoming you to this program, is what is celiac artery aneurysms, and why is it so dangerous? Tell us about the disease first.
Subhanallah, yani, this is what you call it, yani, one of the soldiers of Allah. Something they, wallahi, yani, it's a very rare disease. It's the immune system of the body who's protecting the body. Sometimes they lose control and attack the body itself. And this attack goes to a certain tissue or a certain part from the body. In my case, it was attacking the blood arteries. And they call it the middle size, middle size in general, middle size, which is most likely is in the gut area. This is classified as environmental genetic autoimmune system disease. It's not inherited, and it's genetically there's something changed in the body usually, so it causes this immune system to do this weird behavior with the body itself. The problem is when it attacks, sometimes it attacks the nerves, sometimes it attacks the muscles. So in my case, it was the blood arteries, but usually when it's attacked, for example, if it's attacking the nerves of the coming out from the brain, or it will cause maybe to die directly because losing control of the breathing muscles or other critical parts in the body. So sometimes it will be very, very dangerous. Sometimes it will be lighter and lighter. Well, alhamdulillah, and it's different levels of this disease.
In your case, did it attack the nerves, the muscles, or something else?
Only the blood veins in the inside the gut area, at the middle size. So it caused a big inflammation in the arteries, and so it caused to block it. So the blood wasn't able to reach the pancreas, the gut, the stomach, the liver, the kidneys. So within a few days, my kidneys and liver functions went from 100% down to 10% from within 4 days.
And what were the symptoms that you were feeling without knowing all of this?
It was a sudden, and why I went to the hospital because there is a huge pain exploded in my chest. So I went in emergency car directly to the hospital. Within 10-15 minutes, I was there. But after that, the pain went down to the gut area, mostly in the liver area. So it's the right side of the body, of the gut area. Severe pain, a huge pain. I couldn't lay down or sit or stand for a few days, even with morphine, with tramadol in the like IV liquids. It was severe pain for 5 days. Subhanallah, I couldn't sleep even for a single minute in these days, but it wasn't controllable at all. Subhanallah. Like, alhamdulillah, alhamdulillah.
So when you first arrived at the hospital, did they diagnose you straight away? And what
No,
was what? Yeah,
no.
please tell me more about that, and also tell me. Yeah, go ahead.
Yeah. Because it's a very rare disease. It's not known. It's a few hundred cases around the world documented, not more. So it's very, very rare. It's one for every tens of millions of people, yeah, as a percentage. When I went to the hospital, they start with the CT scan and they do the tissues before. It took more than 24 hours to diagnose the case, and then I had to change the hospital to more specialized hospital in these things. So I went after 2 days to another hospital, and I did the CT scan again. I do the blood test, liver functions, kidney functions, every 4 hours, 6 times a day. To monitor the body functions, the main functions. My blood pressure was around 200. I saw the reading 195, 190 a few times within the first 3 days. It was very, very difficult. I couldn't even breathe from the pain in the stomach at that because there's no blood reaching the stomach. So it was really hurting a lot. I couldn't eat anything. I couldn't even drink anything. Subhanallah. Sometimes I had to enter my fingers in my throat just to open it to breathe. It was very, very tough days. Alhamdulillah.
Wow, subhanallah, subhanallah. What was the hospital's protocol at this point to, number one, treat this case, and number two, to try to limit the amount of pain that you had?
The amount of pain, the only protocol for that is the painkiller, and I took the heaviest doses ever they can for a human being. They said we cannot give you anything more, or you will go into a coma. Yani, this is the maximum we can get. It was a tramadol and morphine. They give it to me as IV liquids. From Friday until Tuesday evening, I didn't have any effect from these painkillers. Until Wednesday, alhamdulillah, the pain start to go down. This is for the pain, but to their protocol to control this case, they gave me high doses of cortisone at the beginning, and then they were insisting to give me a chemotherapy after the 5th day in the hospital. So they gave me cortisone 1 gram, not milligram, 1 gram, 3 times, Monday, Tuesday, and Wednesday, and then they reduced the dose to 120 milligram a day for a few days, and then they told me within the 3 months we have to reduce it gradually in the 3 months.
Okay, so let's begin with the cortisone. This is a huge dose of cortisone. What were they trying to do? What were they trying to do with it?
Just to control the inflammation at that time. Yeah, because they want to reduce the inflammation so some blood can start going into the veins to the organs.
Okay, so this was like a life-saving treatment that the hospital was trying to administer for you.
Exactly.
So they suggested chemotherapy. I understand this is
No, it wasn't a suggestion. It wasn't a suggestion. They tried to force it a lot. Even they offered to help me with the fees of it because it's outside the health insurance I have. So they said, okay, we'll get you a discount, but you have to take it. We can support you with the first dose. This treatment, it's 3 doses every 6 months, lifelong.
Forever.
So forever.
So what's the rationale behind this? Was it to kind of bring down your immune system, which was fighting you?
Exactly. Just to keep it down, not acting properly, so it doesn't attack the blood veins. But in the same time, it will cause a lot of things, as you know. So it will cause that I have to take antibiotics. I will have a very weak body. It will kill the fertility. And it will kill other organs actually. And by 50%, I will get bladder cancer because of this treatment. It's crazy. It's crazy.
So chemotherapy, as we all know, is extremely toxic. So the toxicity of the chemotherapy itself, although their goal is to try to use it to save you, could possibly also damage your organs and your arteries even further and potentially also kill you.
Not possibly. It will kill me, but let's say within 2 years or 3 years. يعني الأجال من الله يعني but when we look to it materialistic way, the chemotherapy will kill anybody within a few years because it's not something I can handle for like the cancer patient. They take, let's say, 6, 10, 12, whatever the protocol is, doses, and that's it. They go to another protocol. In my case, it's autoimmune system disease. It means it's not something I can get rid of. I cannot take it out from the body. So I have to take it forever. And I have to manage the side effects of the chemotherapy forever. This forever is 3 to 4 years usually.
Subhanallah. So really what you're saying is that this disease, there is, not only is it extremely rare, but the survival rate is essentially zero.
Zero in the severe cases, as the doctors told me, it's in the normal cases, 80% of people will die in the first 2 years. 100% of people, they die within 5 years.
Subhanallah. May Allah give you a complete and full recovery. How long ago has this been now? Did this case take place?
15 months.
15 months ago.
16 months, yes. 16 months.
Okay, so now that brings us to our next question. Mu'min, what happened when you decided to take a different approach from what they were not just suggesting to you, but essentially forcing you to do with the modern medical treatment? Tell us about that, and tell us about your experience with Hakim Shahbaz.
Before that, let me mention something about the decision I made. It wasn't only, I couldn't take this decision alone, actually. When anyone in my situation will, 3 different teams of doctors will tell you that you have a few hours to live and you have to say goodbye to your family, bring your kids around you. You cannot take a decision at that time other than the decision you see that it will extend your time a little bit. whatever it is. Is that right? This is the only decision you can choose if you have any.
I can't even imagine, Mu'min, in order to be able to answer that question, what I would do or think in your situation under that kind of pressure.
Alhamdulillah, Allah subhanahu wa ta'ala made it easy for me. And they told me that this is, and you have only a few hours. It's not a matter of days, it's a matter of hours because the kidneys and liver functions went to 10%. So within 3 days. So it means within a few hours it's gone. And here they asked me to take the chemotherapy. So my answer will be, I'll do anything to extend my time in this life. This normal people or logical people will do. Before that, I contacted Hakim Shahbaz, and he told me to don't drink or eat anything. Just take this. He gave me some supplements, not herbs, sorry, not supplements, herbs to drink it. He said, don't eat or do anything for now. Just wait a little bit and take the turmeric and some garlic and with the high doses, and that's it. The point is, I couldn't say no to chemotherapy without Hakim Shahbaz because he told me that, look, this will destroy your body. This is killing you, whatever the case is. And I know that actually because I work with the field with some hospitals here, and I know what they give to the cancer patients, and I know what's the effect of the chemotherapy. So Alhamdulillah, Allah Jazeel Khair, he helped me a lot to resist the logical decision that anyone will take at that position or at that time.
Really, my mind is blown right now for someone to have the courage, first of all, to do this because, you have all of these professionals, you have all of these people who are working in these institutions, you have people with all of this medical experience and history, and it's not easy by any stretch of the imagination to say no.
It wasn't easy. Wallahi, it wasn't easy. Well, alhamdulillah, it was, alhamdulillah, inshallah, it was the right decision to be made, alhamdulillah. And then I followed the system of Hakim Shahbaz very strictly. It's very strict system, very logical system, very good system for the body. I followed it for a year now, and alhamdulillah, it's more than a year actually. Within the first 3 months, it was very tough, but after that, you can see the energy in your body. I have different issues in my body, like the headache, the some eczema in my legs, and it disappeared. My God.
Before we get to, you jumped ahead a year. What happened in the hospital when you began the system and you were still there?
They went crazy. The doctors went crazy, and they asked me to sign a paper that this is my own responsibility if I die. I said, okay, I will sign it. I signed this paper, and subhanallah, after the 6th day in the hospital, my readings, my blood, my kidney and liver functions start going up, which went to 30%. And then within 2 weeks, it went more than 70% back.
So in 2 weeks.
In 2 weeks. In 2 weeks.
Ya subhanallah. Ya subhanallah.
In 2 weeks. Yes. In 2 weeks, let's say 10 days after I start the treatment of Hakim Shahbaz. At that time, I got the cortisone also. So it was a mixed effect. But after that, I didn't take any medication. and I started taking the cortisol down faster and faster. Within less than 2 months, I stopped the cortisol as with the consultation of Hakim Shahbaz, and I was going only with the system he gave to me.
And what was the hospital's reaction as they're seeing your functions improving so rapidly when the situation was extremely serious and dire?
I told them what's going on. They said, we don't know. We don't know how you are alive now. We have no explanation. Wallahi, this is the answer they gave me. We don't know. I'm talking about the top doctors and top hospital in Jordan. They said we have no explanation, even if after 40 days when I visited my doctor, she said, she asked me, who are you? I said, I'm Mu'min, that patient who was in the hospital. She said, I don't believe that. I don't believe that you are still alive. You are walking now. You are walking.
Ya Allah, Ya Allah, you're giving me shivers in my
Well, see, this is what
on my
happens
skin and my back.
me and the doctors.
Mu'min, you have moved with this program with Hakim Shahbaz now.
Yep.
And now you're hopefully, inshallah ta'ala, not just recovered, but this idea of, 2 years and 80% survival rate and 5 years and not a survival rate, excuse me, 80% mortality rate and 5 years, 100% mortality rate.
Yep.
What did the doctor say about that? And what did Hakim Shahbaz say in terms of what's going to happen to your body?
Doctors, they said that you will not survive from this without the chemotherapy. It means we have to kill your immune system to stay alive, to don't attack the body again. How to do that? With the chemotherapy, and we try to manage the side effects of the chemotherapy. This is a clear protocol they have, because I consulted the 3 hospitals in Turkey, in the US, and in Jordan. They said the exactly same protocol they have. They have the same school, same protocols worldwide. Hakim Shahbaz told me that within, as I remember, within 6 months, the body will be, we are doing a reset to the body. So this issue will disappear. And just follow the system, manage your what's going into your body, and everything will be fine. And what I saw in the first few months proved that this is 100% right.
That's it's incredible to hear this, Mu'min. We're grateful to Allah subhanahu wa ta'ala for this incredible, miraculous recovery that He provided you with His omnipotent power through the healing method that you adopted. Alhamdulillah wa shukrulillah. How do you feel now? And how did you feel before all of this started 15 months ago?
Yeah. Subhanallah, in the first 3 months, it was very tough because I had a severe pain in the gut area. I couldn't pray standing for or to make sujood for 3 months. But after that, I start moving a little bit better, alhamdulillah. What I noticed, and of course, I lost around 30 kilos from my weight, 27 kilos from my weight, exactly, within the 3 months.
Now, Mu'min, I've always known you weren't exactly overweight or fat before. I can't imagine 27 kilos being lost on that body of yours. That you were basically skin and bones.
Exactly. I was very thin after that, but it's one of the things that Hakim Shahbaz mentioned, that your body has to strive to heal quicker, and then to take the right ingredients from the food. But alhamdulillah, I was thin, but I wasn't weak. So I had a power when you tell anyone that you have to follow this system or this diet, say you are crazy. But when I told Hakim Shahbaz, Hakim, I'm losing weight very quickly. This is not healthy. He said, look at yourself. You are thin, but you are energetic and you are alive and you are strong. And so what you want? Why you need the weight? You don't need it.
Subhanallah,
Yeah.
subhanallah.
But I
And
used to be fat, but that's it. And this is the, the problem.
what did you mentioned the eczema before, the headaches.
Yeah.
Your line of work, which is a stressful line of work.
Yep.
What has this program had an effect on these kind of side symptoms and side issues that you were suffering with, aside from the major autoimmune disease?
Yep. I didn't suffer from anything on the long term, other than some eczema. It comes and goes in the legs, and the headache and the sleep quality. So these three things was improved very well. The eczema disappeared, headache disappeared, and alhamdulillah, the sleep quality is much better than before.
Alhamdulillah ala salama.
And of course, I lost a good weight. For me, alhamdulillah, now it's easier for my knees. We are in our 40s. We have to take care of this.
Well, I'm glad to hear that all the old clothes in your closet now fit nicely.
Exactly, exactly, exactly.
Alhamdulillah,
I'm
alhamdulillah.
thinking about modeling business now.
We're sitting here, woman, and we're laughing and we're joking, but I can't overstate the real seriousness of the fact that we almost lost you, subhanallah, to this attack, and here you are, in full health, vibrant, back to work, back to doing your community service, back to helping others, and this is a really a remarkable case of recovery. We're talking a few hours to live, to now, here we are, 15 months later, and inshallah, many more years of good health.
يا رب يا رب يا رب بكرم رب العالمين. ولكن الحمد لله يعني it wasn't expected at all. I actually, to be honest, I wasn't expecting this effect on my case this fast or this way. My mom used to do Hakim Shahbaz's system, and she stopped the blood pressure medication after 30 years of taking this medication within the first 20 days. So I was expecting some improvement, but not that much. Yeah, because my case was very severe, but alhamdulillah, now since after 5 months of that time, I went back to my normal life with 80%, now 100%. I'm practicing my daily life as usual, as before. Alhamdulillah, except that I'm not allowed to do sports.
Well, congratulations and Mubarak, and alhamdulillah, salama. And we're more than thrilled to have you here to share this really inspiring story with all of us. And we thank you for coming on the program. And we hope to have you again soon. And inshallah ta'ala, we will follow up with your case, and we only hope to hear more progress and more good news in terms of your health, Mu'min.
آمين يا رب آمين. الحمد لله بفضل الله وثم فضل حكيم شهباز. يعني الحمد لله أنا وصلت إلى I reached this way, this far. الحمد لله, and I hope to get the shifa from Allah بإذن الله. Inshallah, forever. Inshallah.
Thank you so much, Mu'min, for your time, and we'll be in touch soon. You take care. Assalamu alaikum.